Welcome to Talking with Tech. I'm your host, Rachel Meadle, joined as always by Chris Bouguet. Hey, Chris.
Hey, how's it going, Rachel?
Not too bad. We have some really unfortunate news to kind of talk through today.
Yeah, we took the last 2 weeks off, and during those weeks, we had some tragic news in the world of AAC.
Yeah, so unfortunately, Jane Odom has passed away unexpectedly. I think it was kind of a shock to the whole community. She just kind of passed away in her sleep, and it's so sad. She has been such an inspiration and such a force in the AAC world, and just has such a vibrant energy and did so much. So many great things for our field, and just was such a great person, all in all. So we're really sad to kind of hear the news, and I was shocked. You had texted me, Chris, and I could not believe it.
I saw it on Facebook. My good friend Matthew Press had posted it, and I was like, wait, what? And then did some research and found out, sure enough, that Jane had passed away. And immediately my mind went into reflection mode, like how the times that I've spent with Jane over the last, she's been such a great friend and colleague and someone I've presented with. And I'm just so going to miss her energy and her light. Did you know her in person, Rachel?
Yeah, so her and I had met, and actually she's been on the podcast. So that's how I first met her. And she's been on the podcast twice. The first time was with me, and then the second time was with you, I think, Chris. Mm-hmm. And she actually went to Temple. So I feel like we were always really connected on Temple. And then, of course, the Eagles, whenever it was football season. Her and I were friends on Facebook, and yeah, I would just always comment whenever she would show her Philly pride, because I think most of you guys know I'm from Philadelphia, or from Pennsylvania. I went to school in Philly and went to school at Temple for both my undergrad and my master's for speech. And that's where she went to. So we had a lot to talk about and connect with on the Philly front.
So you knew her from Temple, but no, you just both went to Temple. How did you first meet her?
I met her through the podcast. The interview, I kind of tagged along with Lucas when Lucas was still on the podcast. And that was initially how I met her.
The way I first met her was at the Assistive Technology Industry Association conference. Beth Poss and I had presented there for many, many, many years. And so Beth and I were sitting having dinner, and again, many years ago, and Jane came by. It's like, oh, hi, Beth. And Beth was like, Chris, do you know Jane? Jane, do you know Chris? And we're like, actually, we've never met. We've knew each other's names, but we haven't met. So then we sat and had dinner together, and then we have been friends ever since. In fact, even presenting together at ATIA, and we went to FETC and presented together. And in fact, that's where some of our podcast recordings have been, is we were doing stuff on robots together and working with Apple to make sure their voice recognition's application, their accessibility feature of voice recognition and voice control worked with AAC, and sure enough, it did. And of course, we got together at FETC and we're talking about it, but the whole time we were on the buses talking about, transporting back and forth, talking about the world of AAC in general. She introduced me to so many AAC users, and then just we had a great time hanging out at the different conferences together. So, hearing of her passing was really, it's really sad and tragic. People might not also know that she was sort of the driving force and inspiration behind the AAC Language Lab, the PRC product, the AAC Language Lab. That was sort of Jane's work, I'm sure there was other people that influenced it and added to it, but Jane was the driving force behind that endeavor. So if you've ever enjoyed anything from the AAC Language Lab, it's because of Jane Odom.
Yeah, and she would frequently do Facebook Lives all about therapy ideas, and I don't know if that started during the pandemic or what, but I just remember hopping on sometimes to Facebook, and it would be Jane Odom is live, and she had such great therapy ideas, and what I loved about her is that she was so practical. I feel like she was just keep it fun, keep it engaging, here's some ideas, and she kind of simplified it, which I think is really helpful in AAC because it's so overwhelming and daunting when you kind of get caught up in the technical details. And I feel like that was one thing that she was really good at, was just kind of really simplifying it and saying like, let's just keep this fun. Like, what's fun? Like, farting is funny, and just like really like love that about her.
Yeah, and I think there's been a whole crew for years that have been shouting from the rooftops about literacy, and Jane was certainly one of those people. And again, with her work with the AAC Language Lab, it's evidenced in that work, So again, this is not a commercial for the AAC Language Lab, but they definitely have free stuff over there that you can go and enjoy and get a feel for. But if you did not know Jane, that would be a way to go learn about who Jane was, because that work there is illustrative of her beliefs and the kind of person that she was. This community, the Talking Tech community, and then the larger AAC community, is pretty tight. There's a lot of people that know each other. I guess that's many professions, but I just don't know of professions that are quite as tight as this one, where everyone does sort of kind of know each other's names or referenced each other in some regard. And Jane was a champion for that, connecting people together. At the risk of making an awkward transition here, I did get to go to ISTE, where I got to connect with other people. Jane, the reason I bring that up now is Jane was also a driving force, saying AAC companies, not just PRC that she worked for, but companies in general, need to be at these big ed tech conferences to start to bridge the gap between the worlds of special education and general education. I mean, that was some of the conversations I had with her when we were at FETC, is the Future Educational Technology Conference, or Future Educators for Technology Conference. And she was like, we need to be here. We need to be sharing these concepts and being a force for inclusion, because it's not going to happen generically. It's going to happen with consistent effort. And so that's why we were there, working with the companies that were that have been embracing accessibility, thinking about AAC in a broader sense, not just this niche thing that a few people do, but kind of understanding that that the way forward is together, not apart, and we have to come to these conferences. So I've taken her message, and I've definitely taken it to heart. I mean, I've always believed it, but I've also think it could be a calling for all of us to continue Jane's work, is to help come to these general ed conferences and blow the trumpet for AAC and inclusion.
I also think that there's, I absolutely agree with you, Chris. I feel like it's really important for us to kind of put AAC on the map in a lot of ways, especially at these kind of big conventions where, everyone kind of is coming together for education and technology, because AAC is a part of that. I also think that, it's really important to kind of spread that message, even just kind of at an individual level. Like, I have, some AAC apps on my phone, and when I meet people, yesterday I was at a barbecue and everyone's like, what do you do? I'm like, well, like, it's kind of complicated. Like, how much time do you have? And I start talking about AAC, and they like really don't understand in a lot of ways if it's someone who's not, connected to, individuals with disabilities. And so I just like pull it out and I'm like, here's what it looks like. And so anyway, I feel like we can all kind of do our part. And sometimes we forget, that people don't know about what AAC is and the impact it can have. And I feel like, it's part of our responsibility as educators and clinicians to share that and to make people aware of it. And what's cool is that we see movies and television shows now, and we're seeing individuals with disabilities. We're seeing AAC more, which is really exciting. But I feel like we can all kind of take that, and really run with it as far as increasing awareness, because that's how we're going to change, the way things are done and the access that our students have to AAC.
Speaking of ISTE really quickly, I just want to shout out two, one's an organization and one, or a company, I guess, and the other is a person. So at ISTE, the only company that was sort of special ed focused that I saw that might be in the realm of AAC was Toby Dynavox was there at this. So ISTE is the International Society for Technology and Education. I just want to shout out to Toby Dynavox, who was there representing at this conference. I think maybe promoting the use of symbols for a larger audience, but these are the sorts of conversations that need to be happening. And then a second shout out to Lisa Helen. Lisa, hi. Lisa is a longtime Patreon supporter and listener to the podcast, and I was like, hey, I know you. And she was like, I know you, and we had a bunch of conversations. She came to the Inclusive Learning Playground where we chatted for a while. So it was just great to see, again, this work happening of bridging the gap between educators that might not be thinking of special education, certainly educators that might not be thinking about AAC, and bringing it to conferences or other experiences into the general ed realm, making it part of their consciousness,
Yeah, you sent me a picture with Lisa. And so I'm saying, hi, Lisa. I'm so happy to have you as a Patreon member. And we just are so thankful for your support. We also, Chris, we have 2 other Patreon members. Can I shout them out? They're new.
Of course.
We also want to welcome Jenna and Margaret to our Patreon. Patreon is a place where you can help support this podcast. If you really love it and you want even more content on AAC and you want to support us, you can go to patreon.com/talkingwithtech.
I think something else that happened is someone upped their Patreon. So someone went from $8 to $10, said, oh, you know what, I can afford another $2 a month. And they upped, because we suggest $8, but it could be anything. It could be $4, it could be $2, it could be $10, it could be $12. It's whatever you decide what you want to. We just suggest $8. So thank you, Liz, I think, for doing that. And we appreciate that. So, Rachel, tell us about our interview today. In fact, I have a sneak peek. I saw I know at least one of the people in this interview, and I'm a little jealous that I didn't get to be in the interview.
I had the pleasure of interviewing Vicki Haddix and Janine Peca. Vicki is a clinical associate professor at the University of Memphis, and she teaches graduate level coursework on AAC, which I feel like not every university even has AAC, an AAC course. And so I actually saw Vicki and met her at ATIA last year and was able to attend her session that was all about coaching and mentorship. So she came on and talked all about what she does with her students. And then, we're going to have, so this is part 1. And then next week, we're going to air part 2. So Janine is a student, an autistic student actually of Vicki's, who talks all about what it's like to be autistic and to be in graduate school for speech language pathology. And so I'm super excited for this episode. So this is part 1 with Vicki Haddix and Janine Peca.
Hello, my name is Lance McLemore, and I am a team member with Impact Voices. AAC users make up a very small percentage of the population. We are scattered, isolated, and rarely or never get to meet anyone like us. This makes it difficult to impossible to have a community. Impact Voices helps to fill in that gap. Impact Voices is a non-profit organization who supports, empowers, and connects AAC users worldwide. Impact Voices connects AAC users together to empower them to make an impact in their community. Impact Voices creates a space where AAC users of different abilities and experience come together to talk, laugh, encourage each other, and enjoy the company of others like ourselves. For more information on Impact Voices and to get involved, visit our website, connect with us on Facebook, Instagram, and LinkedIn.
Welcome to Talking with Tech. I'm your host, Rachel Madel, joined today by Vicki Haddix and Janine Peca. Super excited to have you guys on today. We're going to be talking all about pre-service SLPs, graduate programs. Vicki, we met at ATIA, and you did an amazing presentation there. So super excited to talk about all those things. But first, let's just introduce yourselves and tell our listeners a little bit about yourself.
Sure. So I'm Vicki Haddix. I'm an SLP and also clinical associate professor at the University of Memphis. I have been here since 2015, and this summer session will be the 10th time that I've taught AAC at the graduate level. Before that, I worked in Boston Public Schools as their AAC specialist and then kind of transitioned into this clinical supervisor role.
Amazing. Janine.
Yes, my name is Janine Peca, and I'm a recent spring graduate of the University of Memphis.
Hey, congratulations, Janine. It feels so good when you're finally finished.
I know. I don't have homework every day anymore. It's a nice transition. So I'm actually autistic myself. I was diagnosed by two independent sources when I was in undergrad, and I can talk more about that later. And I'm very interested in medically complex patients, especially pediatrics, all things autism, AAC, just figuring out ways to help people communicate that do have that level of complexity.
Well, that's what this podcast is all about. So we're really excited that you have that passion and that you can share your unique perspective with us. I know, Vicki, part of the reason that we connected was because I attended your session at ATIA, which I feel like prior to that session, we had like a really rich conversation at AT Chat. So yeah, just share a little bit about, your course that you presented at ATIA. I feel like it was really, really awesome. I was really interested because it was all about mentorship and how do we teach pre-service SLPs about AAC? Because we know that many people's experiences was, I had like either one day of AAC or maybe I had a class, but I never got to actually see an AAC system. So we know it's an area of our field that's really important. And, oftentimes not really, it's not really an area of strength. When pre-service SLPs become SLPs, they're like, okay, I still don't feel like I know what I'm doing.
Yes. Well, and sometimes I'm not sure they know what they're doing. But so I don't necessarily think AAC is the only area that they might feel that way, but it's definitely one of the ones we hear more about. So the class here is a 3-credit class, but it is an elective. Mm-hmm. So not everybody takes it. I'd say about a half to 2/3 of the student body ends up taking it. Mm-hmm. It's offered twice a year so that I can keep the class down in terms of attendance, because you get a more hands-on experience with fewer people in mm-hmm. the classroom. So I recognize that the way that I do things here is absolutely a privilege in some ways. Also, because I'm the clinical professor, I see probably 80% of the students that I have in class, I've also had in clinic.
Awesome.
So I am, so the way that I teach it is definitely influenced by those two things. Mm-hmm. And also that it's an elective, so I get to play a little bit. And I really do have some fun changing the course design and how I design things, and implementing a lot of stuff around UDL. And I've been really influenced by thinking about the ungrading, not that we can go completely ungraded in graduate school. I love that, but at least right now we're stuck giving grades. So trying to figure out ways to make the course more accessible and more interesting, and that people want to take it. So that's been kind of my perspective. Pre-service SLPs is just I want them to want to take it, to see the need for taking AAC as part of your graduate school program. I get a lot of emails from people who didn't take the class afterwards wanting me to summarize it in an email, which is, it's a 3-credit class. It's hard to do that in an email.
That feels impossible.
Right. So take the class while you have the opportunity. Having said that, a lot of people don't. And so I think the role of mentoring is absolutely one of the things that we need to think about going forward. I think the greatest need for mentoring is often in the AAC evaluation realm. At least that's what I get a lot of questions from, and I think you guys do too.
Totally. And then it's like people will send us an email with like all of the stats, like 6-year-old autism. And I'm like, and what device? And I'm like, if we could just simplify the AAC assessment process to an email, like it would be so great. But unfortunately, that's not enough information to figure out even what to start trialing oftentimes.
Yeah. So that's, and I also think that's hard because part of being a good AAC evaluator is knowing all the systems that are out there and how to match them to the kids. So even if you could be really good at and have a great relationship with those kids that you're evaluating, if you don't know the systems, it's going to be difficult to do that. So and because the systems are ever changing, it's kind of a continuously moving goal. So I don't mean to imply this is an easy task. And I think it's hard to teach in grad school because of that. It's hard to get a whole semester, even in a 3-credit semester class, we cannot spend that much time just diving into all the different features of the device. I can kind of go into them a little bit, and they've definitely got hands-on time throughout the semester with it, but it's hard to know the devices to the level that I think you need to for good evaluations in a graduate school class. So I don't know that even with the perfect pre-service prep in AAC, I think we're still going to be at the stage where we need mentors going forward. So that's kind of what I've been playing around with is how do we do this mentorship thing once people graduate? And I've tried a couple of different ways, and I don't know that I've hit this is exactly the way to do it, but at least we've tried a few things. As I've done the mentoring online, people sign up for about 10 hours, so it's one ASHA CEU. And we do online mentoring, which has been great, but that's capacity-wise is a bit of a challenge because, I have this other job. So, and then I'm toying with the idea of doing just a specific 2-credit AAC class for SLPs in schools that would be online and probably at least half asynchronous for the fall, but yeah, I think the stuff that has been most successful are the people that I see through either the grant that I have to build AAC capacity throughout Western Tennessee, or my coworkers who I see on a pretty regular basis. We've done pretty similar to graduate education, and the idea of doing some initial learning, some initial here, go listen to this podcast or go watch this webinar. This is exactly what you're having questions about. They talk this through. Or this is all of this wonderful posts that Lauren Enders had about setting goals on practical AAC, like writing goals for so a lot of being a mentor is knowing where the good resources are and pointing people in that direction. And then let's talk about them afterwards. Let's put this into practice with the client you have in front of you. So I've been trying to do a lot of that.
Well, and I also think that part of the problem whenever you have a situation where there's a lot to teach, there's not a lot of teachers, and there's not a lot of time across the board, how can we figure out ways to not reinvent the wheel and to use asynchronous learning as a way to prep students and, SLPs for the kinds of information that needs to build a strong foundation. And then it's the time we spend together, actually in real time, is time where I can answer your questions and I can help do things that I can't do asynchronously, and the specific things. I also think about this when I'm working, because I'm in private practice. So I'm trying to prep families in that way when I'm working with them, because I don't have a lot of time. I have a long wait list of people waiting to see me. And I'm thinking, how can I create asynchronous learning so that by the time you get to me, you already know what core words are, the importance of modeling. Of course, I'll reiterate those things, but how can we really think about asynchronous learning now that we have technology that's so easily accessible? And now, after the pandemic, we have most people who feel more comfortable, at least, with technology. So it sounds like kind of you're thinking through that lens a little bit too.
Yeah, trying to figure out how to really curate the resources for people, I think, is a big thing, because there really has been an explosion of resources in the last few years, especially since the pandemic, where there's so much on YouTube, and some of it is better than others.
True.
And I think a lot of times people will, if there's only 10 minutes out of an hour long presentation that's really relevant to them at that moment, they're not necessarily going to stick with it. But if I can give them this is exactly like this presentation on AAC in the cloud is exactly this thing, like go watch it. That I think people are way more invested in. So I don't know how to do this, and I don't have the web skills at the moment to do it, but I would love to have that kind of curation out there so that it's not just people don't have to come to me to get that. They can just type into this website of this is specifically how do I get somebody interested in AAC, like how do I get teacher buy-in, like just be able to type that into the search engine and it comes up with some recommended websites, podcasts, and webinars to watch, listen, and read. Of like, here, these are what can point you in the right direction. And then when you still have questions, because you probably will, then let's have a 15-minute discussion, which is way more productive than if I have to go through this hour-long webinar of information. And then, yeah. So that's the sort of thing that I would love to figure out how to make that happen.
Yeah. Well, one thing is, at least for our podcast, if you go to our website, talkingwithtech.org, you actually can search our episodes for the keywords like buy-in, motor planning, parents, like if you want AAC user episodes. So that's definitely a resource for all of our listeners out there who maybe don't know about that. I use that all the time for my own podcast. I'm like, I want to share something about literacy. Like, let me go see what I can share. But it sounds like maybe, and we also, we have a lot of clinical supervisors and professors who are listening to this podcast, who are also actually using the podcast and curating these resources. And it sounds like, that's a huge part of the kind of curriculum development, right? Is like figuring out how to streamline that process. And what I love about what you're saying is, oftentimes we're just sending so much information, and like an hour-long webinar, people have this idea in their head, like, no, like that is so much of a time commitment that I'm going to keep procrastinating it out and out and out until then I eventually never do it. Or I've taken 6 months to do it. And so it's like, I love the idea of time stamping, like this section of this podcast or this section of this webinar, because it just feels more manageable when we have, so much to learn, so many resources out there. How can we start curating the kind of like golden nuggets of information for people?
Yeah, when I started in teaching the AAC course in 2016, there were like 5 websites that had webinars and podcasts that were useful. And now it's
crazy.
It's crazy. There's so many different resources out there that it's that curation part is, I think, a huge part of mentoring.
Yeah, I mean, I agree. And like, I do a lot of mentoring in the work that I do because I have a team of clinicians and they're all trying to learn about AAC. And it's especially relevant in the assessment process. Like you said, I feel like I do a lot more mentorship with the assessments because there's just so much to know, and, all of the different systems, and that whole process is it's challenging. And there's also not a lot of information out there. Like if we're thinking about resources, there's just not a lot on the AAC assessment process. There's tons of stuff on therapy and implementation and, all of those things, which is great. And I feel like people know more about that because there is more information out there, but, there's not as many resources with the assessment process.
Yes. And I also see people getting stuck when they have a kid who is a non-symbolic communicator, who is maybe sort of kind of intentional, but it's still emerging. And they're looking at therapy resources for kids who are like context dependent. And I was like, well, let's back up a second here. Like, let's see the bigger picture here. Let's talk about how to develop that sort of, how to get intentional communication more firmly established to then get to symbolic. Like, we're not at that. Some of those therapy recommendations for more context dependent communicators are not so applicable that kid who doesn't understand that symbol yet. Let's figure out how to teach that part. So that's where I also see people getting confused.
Yeah. And we just like assume when we put like a device in front of a student that they should start using it with accuracy. And so it's like, well, there's so many kind of foundational skills to look for and assess for to determine like, oh, this makes sense. I just did a consult with a 2-year-old. I'm so impressed. This 2-year-old was like, isolating an index point and like accessing like the smallest icon size. I was just like, this is unheard of. Typically, I mean, he's a baby. Like, yep. So anyway, it was just like, thinking about all of those foundations. And a lot of what I was talking with his mom was those foundational communication skills, understanding symbolic representation and just intention and initiation of communication, whatever that looks like. It's like, those are all skills, that we can teach and need to kind of assess for in the assessment process. Because otherwise, yes, like we're using therapy resources and activities and, looking at the way that a student is using a system and thinking like, oh, this isn't working. It's like, well, we have to think about why, and like take all of those things into consideration. So, when you are implementing and say you're listening, you're like, well, I don't really do AAC assessments. Well, we still need to understand how to assess for these things when we're treating students who use AAC. It's like, we can't have one without the other. So it's like, how can we teach people about both of those things?
Right. And if they just got a device, I'm not saying that it's not the appropriate thing, but how you use a device with a kid who is still emerging versus how you use the device with somebody who's context dependent is different. And it's helpful to know that.
Totally.
And to look at resources that point you in the direction of therapy strategies that are useful for those guys.
Yeah, no, I completely agree. What's one thing that you found over the years, Vicki, that you found the biggest impact as far as like, wow, like this thing really helped? I mean, we talked about the resources and curating that. Is there anything else that kind of sticks out in your mind as something that like, I learned this throughout the years as something that's really helpful for students and pre-service SLPs or, CFYs who are learning about AAC?
And when I get those emails from people who like want me to summarize the class in an email thing, I send them to 3 things. The practical AAC website with some ideas of how to search it, because it can be overwhelming. The AAC in the cloud webinars, and then your Talking with Tech podcast. And I do those 3 things because that's a like reading, a watching, and a listening thing. So UDL is a wonderful thing. So I don't personally do a whole lot of podcasts. I just, my brain doesn't work that way. Mm-hmm. I can sometimes, but it's almost never my first thing. Webinars also rarely my first thing, although I've gotten more into them since the pandemic. But reading has always been like, give me a good blog post. That's absolutely where I'm learning from. But other people have different learning styles. And so I try and make sure when I email people that they get those 3 different options. So whichever one works for them, go for it. Well, so Vicki, it's hard to give you just one.
Those are awesome resources. We will forgive you that I'm hearing you're not a podcast fan. No, I'm just kidding.
Sorry. I try. I really do.
You're forgiven. No, but what I love about what you're saying is you're really thinking about how people learn in different ways. And I feel like that kind of UDL, universal design for learning, has to be a part of, the things that we're doing for our students that we're teaching in graduate school, for our students that we're working with, who are AAC users, for the professionals that we're teaching, if we have capacity to teach other professionals about this. So I love that you're talking about that. I want to pull you in, Janine, because I know, Vicki, we talked about UDL. You were able to work with Janine. Talk a little bit about, first, let's talk about neurodiversity. Janine, can you kind of define that for people who are like, what does that mean? What is Rachel talking about?
I can attempt to. So the definition actually does surprisingly change depending on who you ask to an extent. So neurodiversity essentially is what it sounds like. It's neuro diversity. So different types of brains, diverse types of brains is the idea behind it. Typically it refers to autism. So like having the neurotypical brain, as it's called, which is the non-autistic brain type, and then having the autistic brain type as the neurodivergent brain type. Typically, this is called neurotypical and neurodiverse. I personally prefer my own terms, which is neuromajority and neurominority, because it takes away that typical stigma out of that.
Love that.
And when I've done presentations on it, those are the terms that I feel most comfortable using, but it's going to depend on person to person. Sometimes, depending on who you ask, neurodiversity also includes the ADHD style brain, and sometimes some other styles of brains with different interpretations. That's the most basic definition I can come up with. Vicki, if you want to add anything, please.
I thought that was beautiful. That was beautiful, Janine. I love that. So tell me a little bit about your experience as being autistic in a graduate school program. I'd love to hear just like your experience. And also, I'd love kind of, Vicki, for you to share the things that you're thinking about maybe a little bit differently to make sure that you are inclusive of neurodiversity with the teaching that you're doing. So Janine, first, just share a little bit about your experience.
Sure. So I'll actually start off just by kind of sharing my autism journey itself, because everybody who's on the spectrum is very individual, hence why it's called the spectrum. So what I'm going to say today might not apply to half of the people listening, and they might all be screaming at their computer like, no, it's the opposite. And that's totally fine. So anything that I say, is subject to my individual experience, obviously. So my presentation of autism very much fills that female presentation profile very well. I mask very well. I learned how to mask at a very young age. All the signs were there, but I did not get diagnosed until I actually got into undergrad. And I saw 2 different medical professionals to verify the diagnosis, essentially. And that's when I started getting academic accommodations specifically for autism, which I didn't have growing up in grade school, which would have been really nice looking back. So with that, I am someone who was newer to the diagnosis in the community by the time that I hit graduate school, still like 7 years in at that point, but still relatively new. I didn't age with this diagnosis. I was still very much figuring it out. It's really interesting being an autistic SLP student, because you spend a lot of your time learning about how to work with autistic clients. Yeah. So it's an interesting, it's almost like you're within the culture, trying to help the culture. Like you are a source person being taught primarily by people outside of the source, in quotation marks, culture, about what to do with people like you. Yeah. And that is interesting in and of itself for many reasons.
Yeah, I'm curious to dive into that a little bit. Like, how did that feel? And were there moments that you were like, hard no or complete disagree?
Well, so there were some hard no's and some hard yeses. The biggest hard no was I did not take the autism class that is offered at my university. I did not, as someone who is a very big believer in the neurodiverse movement and neuroaffirming care, hearing about the autism class that we had here and where it was, at least when it was offered for me, was not where I'd want it to be in terms of the movement. And my understanding is steps are being taken to push it more into a neuroaffirming, neurodiverse place, but it wasn't there at the time. So I absolutely walked on that. And thankfully, I have wonderful people in my life like Vicki Haddix and other clinical and academic faculty here at the University of Memphis that I knew I would get that training from. But there were definitely a lot of hard yeses. So for example, working with Vicki in AAC, she teaches patients as the clinician, because these individuals, they might need some more time to figure out their language and what they want to say, whether it is on the AAC device or it is going to be through verbal communication. And that was just nice to be explicitly told, because as someone who masks very well, I'm used to the rapid style conversation with other people in the neuromajority. So I need to be explicitly told as an autistic person, you need to calm down, be patient, take a breath, and wait for them, which was really good to hear, because that's something that sometimes I need, and I don't necessarily even realize I need to potentially self-advocate for that because I'm just so used to being in that masking zone of presenting myself as if I'm at a job interview, 24/7, 365 when I'm on the clock. There are some really great hard yeses too, even in class. Like in my school age language class, the professor, Catherine Mendez, she was talking about some, I feel, lesser known things about the autism experience, which was really great. She talked about how sometimes categories that you might put forth might not match what this individual understands and how they conceptualize the world, their schemas. One of the things that she mentioned was autism and emotion. There are plenty of autistic individuals who will use the terms happy, sad, grouchy, glad, and that's great. But then there are some people with autism that don't conceptualize emotions that way, and I'm one of them. I feel a little or a lot of a sad or like a good or a bad type thing. So my day might be big bad or it might be small good. And that's how I understand emotions. So just having someone who had done so much research from resources that were definitely autistic voices to get nuanced elements of the neurodiverse culture, if you will, into their class was really moving for me as a student. I felt super supported in that environment.
I love that. And I'm sure as you were going through this experience, there were so many moments of feeling like validated, first of all, for like your experience and feeling like, wow, someone is like sharing something that really resonates with me. And also it feels like so much self-discovery probably has happened along the journey, both with getting the diagnosis, which is just inevitable, right? You have this new kind of identity to start kind of thinking about and discovering. And then the experience that you have actually learning how to, support autistic students, in the work that you have chosen, a career path in. It just feels so interesting. Love listening to all of these experiences that you've had. And it sounds like it was really powerful for you.
Oh yeah, for sure. No, when it was kind of funny. So how we realized I was autistic, we always knew that something was up. We didn't know what it was. Because, again, I always acted as you would expect a child, however old I was, to act. But my preference was always to stay inside for recess, not go outside and play, not play with all the like really intense, noisy toys and stuff, just kind of play by myself. I really wanted to parallel play as a child, those kinds of things. So how I actually figured out that I was autistic, my mom came up to my room one day when I was studying for a test in undergrad. And she was like, there was this news story on and they were talking about autism. And some of those things, they sound a lot like you. You should look it up. Maybe some of the tricks and tips that they might have for autistic people might help you. And I was like, okay, Mom, I'll look that up. And I'm reading the profile and I'm reading the DSM. And I'm like, oh, okay. Well, feel free to call me out like that, Internet.
Thanks, Mom.
And then I told my mom, no, I don't think that it'll just help me to look at these resources. I think I'm autistic.
Yeah.
And she was like, no, you can't be. You don't act quote unquote autistic. She had only seen the like autism presented as, someone who does not sit still at a table, does a lot of hand flapping, chair rocking, all of those stereotypical stims, is super into trains, that very, very stereotypical presentation. She hadn't had the exposure, unfortunately, at that time. And I, started doing research and I was like, no, autism doesn't look like that necessarily.
It's true.
I got diagnosed. They had to go through a period of acceptance while I was like, yes, finally, I understand. It all makes sense. I have a word for it. I can explain it to people. I can start this journey of self-advocacy. This is the best.